Hello, everyone. I'm Dr. Allison Fiducia, and you've made your way to our monthly psychedelic support speaker series. And today we will be exploring setting within and beyond the psychedelic assisted therapy frameworks. And before we jump in, I did want to let you know that we have a special going on right now at Psychedelic Support for 50% off of our MDMA, psilocybin, and ketamine course bundle, which I will drop a link in. And if you're interested in these topics, they're very comprehensive and they help to support our work here at Psychedelic Support. We will be sharing the video of today's presentation after, along with the resources that are shared in a follow-up email. And our presenter today is a dear friend and colleague, Dr. Lisa Jerome, also known as, she also goes by Ilsa. Dr. Jerome holds a doctorate degree in psychology from the University of Maryland, and she has contributed to many research programs through her decades of work at the Multidisciplinary Association for Psychedelic Studies and later at MAPS PBC, now known as Lykos Therapeutics. She is very interested in understanding the intersection between social cognition and neuroscience and is fascinated by music, a universal human activity, and its function and effects on listeners. She was formerly a DJ, a radio DJ, and now shares playlists on Spotify, which will be giving you some psychedelic playlists that she's helped compose, as well as pulling together a list of other playlists that are used in psychedelic therapy settings. Dr. Jerome is currently exploring new positions in clinical trials in life sciences. And from working together for over 5 years, I can attest to her dedication, her multi-talents, and her hardworking work ethics. So I definitely encourage you to reach out if you need a great person to work with you on your team. And it's an honor to have Dr. Jerome join us today to share her review and insights into the components of setting for psychedelic use. So with that, I'll hand it over to you.
Thanks for the wonderful introduction. I'm really glad to be here and talk about something that is very interesting to me and that I have thought about intermittently a lot. And although I want to stretch the concept of setting uh, beyond as well as within therapy. I am focusing on therapy type settings because that's where the research has happened so far, what little research there has been. And I was really motivated to pull together this talk after reading a review paper by Okano and colleagues about setting, really more codifying or describing setting and how we might think about it for MDMA-assisted therapy. But just in general, I think because my background is in an experimental type of, well, an experimental wing of psychology, not meaning it's how can I put this? They use experiments. I'm not trained as a clinician. I'm trained as a social psychologist. And social psychology really looks at the situation rather than the person. And in a sense, that's one way that we can refer to setting. Setting is the thing around the person. So in this presentation, I'm gonna define the terms. I don't want to spend too much time on that because I think most people have a pretty good working concept of set and setting, but just to address that, the promise of research on setting and some of the challenges that it faces, some examples pulled from recent publications that have tried to wrangle with or study setting, mostly in a therapy context, how we might want to design studies of setting, measure the elements of setting, and then think of a very particular application that is near and dear to my heart about setting and how we might want to make therapy situations, or perhaps others as well, more accessible to people with sensory disabilities. So, set and setting is a phrase that I guess a lot of people here already know. It was popularized by Leary. He may not have invented the phrase, but he's the one who is associated with. Set is what's going on inside the person, people's hopes, fears, thoughts, concepts of what the experience they're having is going to be like, and even things perhaps like how much sleep they've had. Setting includes what's going on outside the person, and that can include physical features of the environment and social features of the environment as well. And this is a sort of just a give you an idea of sort of the difference between set and setting. And set can include things like goals, prior knowledge about an experience. And this can be generalized not just from psychedelic compounds, but just life in general. Although here we are focusing on psychedelics, and I'm using the broader term to include entactogens, MDMA-like drugs. But usually the term does refer to things like psilocybin or LSD that latch onto the 5-HT2A receptor in specific. And you can see here that setting looks at things that can encompass everything from furnishing to where people are in a room, features of those people, social identities, and the kind of relationship that we have with them. I apologize for not using a lot of images in my slides. I just don't tend to think in terms of images. It's not going forward. Whoa. Okay, here we go. So there is a lot of words here. I apologize for words. I guess you will have to generate your own images. So defining setting a little further, we've got physical features like furnishings, ambient temperature, lighting. That includes there's a whole way of describing lighting that includes color temperature, color rendering index, those sorts of things. Sensory aspect of the place, aesthetics, supporting features, artwork, music, all of that is part of setting. And I do have one image that came from the Okano et al. Paper published in 2022. These are rooms that were used for MDMA-assisted therapy. You can see some commonalities. There tends to be artwork. There's an attempt to make the space look, if not homey, just more comfortable than a clinic. You can see um, more lighting from desk lamps instead of, say, overhead. You see beds and couches. So there is a sort of general aesthetic to these spaces. Other things that can be part of setting can be things like this arrangement or placement of people, all of the people in a setting. And this is not just for therapy, but maybe in gatherings or parties, but definitely in therapy, are your guides or therapists standing to your side, or are they in front of you? Do you see them or not? Number of people present, physical characteristics of them, social identities, which sort of intersects there, like apparent gender or race or ethnicity or age, and also the nature of relationships of people. That is, are these people you know? Are they people who you've met before? Are they friends? Are they relations? Do you have prior tension with them or not? Those all, they kind of verge on set as well, but they're part of setting too. Well, why would we want to study setting? I think there are lots of reasons. Most people, of course, think of practical things like how could we make a setting that is most beneficial for whatever goal we have when we are introducing people to a psychedelic compound, maximizing the benefits and minimizing problems. We might also want to understand more about how a compound works by manipulating setting and seeing what happens. Are people more or less aware of visual or auditory inputs? And are they more or less aware of where they are in a space? All that kind of thing could also be studied. And I guess because I'm often thinking about how things work and wanting to look inside, I guess I think of those things too. But there are these also very real world practical reasons why we might want to know what parts of setting have most impact for making a positive, helpful, beneficial experience, or that have the opposite effect and make it harder. So why there haven't been a lot of studies of setting, and I guess really I should say trials here, because there are lots of narratives of setting and observational studies of setting, and there are far fewer trials. And trials allow us to really pick apart the problem of setting. So some of those reasons might relate to difficulty conducting research with scheduled compounds. I think people realize you have extra hoops you have to jump through to do that study. Lack of funding or grant support for research. Of course, that's magnified at the current moment, but I think even before the current situation, it has always been hard to get that kind of funding. And research that involves a trial with human subjects usually does involve some kind of funding. Difficulty isolating and varying a single uh, element of setting, that can be a challenge, especially if you haven't really codified it before. Difficulty measuring that setting, and also I think there is a concern for people within the therapy community of changing an element of setting that might end up harming people. So there's a sort of conservatism in the sense of not wanting to break something that seems to be working. And that does pose a risk if you're going to study it. So a lot of studies to date have been narrative accounts, as I've mentioned, or observational. Some of them have been naturalistic comparison of a situation that's already present and people survey them afterwards. They don't always systematically vary the element, although recent research has definitely tried to do that. And those that have taken place for reasons that I guess may seem easier to understand now tend to be in healthy volunteers. And much to my frustration, almost all of the research looking at elements of setting has been in classic psychedelic compounds and not in entactogens. And I don't know when or if that will change, but I hope it does. The sorts of things that have been looked at have include music, visual imagery or video, um, visual stimulation, social identities of participants and how that affects outcome. And this is one study in healthy volunteers looking at whether a person was also a fellow person was a participant or an experimenter, and whether the participant was under the influence of a drug. Um, those are the sort of studies that I've seen. I was pulled further into my interest in setting and talking about it by a group of relatively recent publications. Two of them occurred in open label studies of psilocybin. One was in a randomized trial of placebo versus LSD, and it's more a study of brain function. You'll notice, though, that in these studies, even though the actual study was open label, and open label means everyone knew that they were getting the drug in question, the actual trial was randomized. And what does that mean? It means that people received um, the condition they were assigned to the condition. So in one case, and I'll get to that one, everyone has the same condition. And this one, people were either assigned to one condition or another. That makes it a between participants or between subjects design. In this study, they either viewed a video for that has nature type images. Unfortunately, journals don't come with video, so I actually have not seen this video and don't know what was on it. But they either saw that or what the authors treated as standard procedures, which is meditation instructions, and they presented them with either the video or the standard instructions prior to having the therapy or guidance session, and then during the drug ascent and descent. They measured a bunch of things, including subjective effects, that is how people were feeling, challenging experiences using a measure that ostensibly measures that, I guess loosely understood as maybe not a bad trip, but just things that were unpleasant, adverse events that were any kind of thing that people didn't like during the experience, cardiovascular effects, and decline in alcohol use disorder. Now, in a sense, the bad news, if it is bad news, is they only found one effect that couldn't have happened by chance, at least according to the statistics, and that's that the peak increase in blood pressure and heart rate was significantly reduced in people who got to watch the nature video compared to those who just heard the meditation instructions. And although it wasn't significant, they did see that people who saw the nature video also had reported anyways lower anxiety. So this is what I'm not going to attempt the name. I guess it's Heinzerling and colleagues, published in 2023, and they looked at a setting element that might be classed as trying to capture bringing nature into the session, in this case by watching a video. The second study that was published in 2021 by Strickland et al. Does tap into one of my interests of music, and they tried to measure different types or styles of music. They made two playlists. One they classified as Western classical music, and the other as overtone-based music. This study used a within subject design, and this is the one where every person in the study received each of the variations in setting. They in one set there were three psilocybin sessions, and this was in a patient population of people in a smoking cessation, a study of psilocybin for smoking cessation. So they had three psilocybin sessions. In one, they could have listened to the playlist with Western classical music. In another, they could have listened to the overtone-based series, and that was randomized in order. So it could have been the first could have been either, and then in the third, they could pick which one they were going to listen to. And they found that people who heard the overtone music experience or in the measure of mystical experiences said that they experienced a more intense mystical experience. And there weren't any other differences, but they did note that a slight majority of people, when they had a choice to pick one of the two playlists, they picked the overtone-based music. And so the conclusion is that that might be a better selection for music within a therapy context. The last study
Wait,
is
before you go on, could you tell us what overtone music is?
it's music where they're using more of the harmonic series. It tends to be simple. It tends to use the harmonics of the instruments rather than use the melodic structure that you might find in classical music.
Okay, thank you.
Okay, so this study, um, I'm ignoring actually in a sense the point that the authors were most focused on, which is brain function, because I'm not very good at reading brain function pictures, but it also did vary both vision and audition, and it was a randomized placebo-controlled study of intravenous LSD. That must have been something. 75 micrograms of LSD or placebo, and they had brain scans and they experienced again all of the conditions. Eyes closed, silence. Well, I mean, silence is relative because if you're in a scanner, it's not actually silent. But anyways, eyes closed with instrumental music, eyes open, no stimuli at all, or eyes open and a silent video. And they looked at brain entropy, and they also had people filling out visual analog scales where you mark a line to represent how you feel. And there's usually a word, there can be two words, representing a subjective effect like feeling drug, positive mood, negative mood. So they measured those things as well as the brain entropy. And they found that brain entropy was reduced when eyes were open, and when eyes were closed, people reported more intense experiences, including more increased simple visual images. And in the case of music, they said that that also increased visual imagery and positive mood under LSD. I'm not, I believe that what they were hoping to show was more focused on brain entropy, but it also suggests that whether you open or close your eyes or are looking at something could have an effect on how you experience the setting. So it's part of the setting. So these studies have some strengths and some limitations. I think where they really do well is trying to focus on specific elements of setting. 2 out of 3 used within subject study design, and the virtue of that is that you are using each person as their own control, and so the noise, so to speak, the noise of having different people experience different conditions, different variables of setting is reduced so that you can reduce that through having the same person be their control. And at least one of the studies compared um, a standard treatment or a placebo with a variation in setting. Um, One of the big limitations, and this is such a common one, I hate saying it, but it's definitely true, especially if you're already trying to get people in for uh, a trial like this where you have to do the extra paperwork and such for psychedelic drugs. They have small sample sizes. 10 and 20 people are not a lot of people to study, and that might be one of the reasons for these studies not finding the sort of dramatic results that we might have hoped for. They focused on only 1 or 2 variations in a setting. For instance, could there be other ways of exposing people to nature or other features of music? And it's not really a criticism that's in a sense it's not fair because of course you can only attack one thing at a time, but it's still there. And use of open label versus having the chance of what would happen if you at least varied placebo versus the drug, which could still be open label, I guess, and some would say it would be, but at least you would be able to compare setting under the drug versus placebo. So if we wanted to design an investigation of the effects of setting, what sort of things would we want to do? I think the first thing you'd want to do is think about those limitations and benefits of different designs. And of course, think about what is available to you. Do you have a large population that you could study or not? Think about what is the standard treatment? And this is a sort of question that I have sometimes when you look at um, trials describing a therapy or even a study in healthy controls was considered standard. And then once you determine that that's what's usually done with the standard, then you can vary the feature of setting, the element that you want to vary, and separate or clarify what everyone can determine, what kind of lighting is there, what kind of music is there, versus how people respond to it. And then specify a clear representation of the variation in setting, like how you're going to describe it. There is something that I found as I prepared prepared this talk that I started thinking about too, and we may be addressing it here or later, and that's control over the setting feature. Can people turn off the music or look away from the artwork? Or do they have input on what sort of things they're going to see and do? And that is perhaps a meta setting is an element of setting that isn't physically there, but is there in terms of setting structure. I need to take a sip of water. So what other things do we want to face when we're designing a study like this? Well, there are risks and benefits of relying on studies in healthy volunteers. I think they're they're easier to do in some respects and they're lower risk, but you also might risk changing or learning something that was true for healthy volunteers and then discovering that it's not the case in a specific patient population. You might want to consider a wider array of contexts. And this is where I think we go beyond the therapy setting, even though that's what has been studied to date, because that in itself is also setting. Therapy is a very restricted in the sense of there are a lot of features that are common and are perhaps not rules but conventions. But other settings, say a gathering of friends, a spiritual retreat, those settings have different rules and conventions. And we might want to see how those different rules and conventions could affect the setting in the general sense, but also specific elements of setting. And then we might want to see the similarities and differences between drug classes. Again, as I mentioned earlier, all of the studies to date, including a lot of the naturalistic studies, have occurred in a small number of classic psychedelics. And I would like to see that branch out. When we think about the types of element, we might want to think about, can we describe it as present or absent, or is it a continuous variable? Some things are either there or not, and some things could be in various formats. Then think about how you're going to describe it, both so you can really design a study that's going to measure that particular element, and also so when you write it up, you know the language you're going to use. Variation on more than one dimension, which may or may not be possible depending on what you're looking at, and the presence and degree of control over the setting element that anyone involved in the situation, from the experimenter or therapist to the participant, has upon that element. Those are all things that seem like they're important. And then you come to how you're going to assess how people experience that setting and how they respond to it. Do you use open-ended response formats, which, in a sense, they are going to measure in the most detail what people experience, what they notice? The catch is that they are harder to address statistically, and it's easier to deal with variables that you can quantify, like a checklist or multiple choice. However, you do lose some of the variability and richness of data when you use that instead of open response. So maybe when you start looking at a setting, you want the open response. And I know that was done in some of the early studies of music and psilocybin. And then later on, you might want to find ways to quantify it more. Then there are things that could change over time within any type of setting. Again, not just a therapy setting. Maybe this is sort of getting too big here, but it's something to think about. What happens when an element of setting changes? I mean, think about time of day, the light that comes in from a place with windows, that can change over time. Does it have an effect? And then eventually, this is, of course, this is where I'm going off into the big picture, where I'm totally ignoring the fact that this is not really fundable or going to grab lots of people, but perhaps developing a shared terminology for types and variation in setting elements. And perhaps this also comes from my own background in terminologies and lexicons that are used for describing adverse events. I don't think we're ever going to develop a medra of psychedelic experiences, and that medra is the terminology that's used for adverse events, but it would be cool if we did. So this is sort of an application that I've discussed with other people off and on. Um, how might when we sort of have, as I mentioned, a very common set of conventions for what we expect, and this is thinking of both MDMA-assisted therapy and psychedelic-assisted therapy, of the sorts of settings that are available. But some of these setting elements, like music, like artwork, like lighting, are not going to be available to everyone within that experience. Some people might be deaf or hard of hearing. Some people might be blind or have a visual impairment. In fact, I'm one of those someones, so this can happen. Is it necessary to replace or amplify a setting element within that therapy setting, or even let's go further out and look at other types of settings, spiritual settings, self-exploration settings? Is it necessary to somehow replace something like music if people can't hear it? Is it necessary for people to replace artwork with something else? And those are really two questions. First, is it important to have that thing or not? And if it is important, what ways could we produce an equivalent effect using some other modality? For instance, could you use fragrance or scents in place of visual stimuli? Could you use textures or movement for music instead? And I know that's, again, a program of research that will only happen in my dreams, but I'm going to stir up the pot and maybe someone somewhere will start thinking about it. You can select some commonly used or accepted setting element. I've already mentioned some. There are probably more. And then think about a measure for that element and then how you might either make it present or absent and see how important is it. Does it have an effect on the positive outcome that you're looking at or how people report their experience? And if it doesn't, well, maybe what does that mean too? Definitely it means it's more accessible to all people undergoing the therapy, but also what does it mean in general? If it is important and it turns out that it does have effect when you don't have music or don't have artwork, is there some way to make something within that setting similar to or that will produce the same sort of effect that is missing for people who are not going to be able to see or hear that element? And that's one of the aspects of studying setting that excites me and I think is pretty interesting is that this is one way to make psychedelic assisted therapy and other experiences with psychedelics more accessible to everyone. So that's what I'm thinking of as particular setting elements. Are they necessary? And then what do we do from there? How might we vary them if it turns out that they are? I forgot that I even had that slide, but it sort of represents the same stuff. So thanks for everyone for listening to me babble about setting and things that I think would be really cool if they ever became studies. Thanks to Allison and Psychedelic Support for letting me share my thoughts. And I hope that this stirred up some thoughts within all of you, especially people who might someday produce this kind of research. Thank you.
Wonderful. Thank you so much, Dr. Jerome. I always love this topic because it can be so varied depending on, as you mentioned, these different frameworks where people may be taking psychedelics, whether that's with a therapeutic setting or at a retreat or at a festival. And it seems to be one of the key pieces in the set and setting equation that can potentially impact the experience. So it's good to see there's some research that's starting to look at these different elements. I would say it's still pretty light about what we know. Um, so we will get into some questions here.
Excellent.
I was curious about the study where they were showing the nature visuals and found an effect there. Do you think that had to do with the visuals being related to natural elements or just more of like a increased stimulation to the visual cortex by having visual presentations there?
You mean like from the first study? I
Yeah.
think that the third study that I presented might sort of comment on some of that, that it's possible that some of those effects, and these were reduced cardiovascular effects, could relate to stimulation of the visual cortex. But since the video was not described in great detail and I didn't see it, I don't know. I mean, that's a really good question. And it seems like there are some direct effects on our brain processing things, and those might down the line affect how we experience that
Yeah.
visual stimulation.
Yeah. So we know from, conventional settings that people might use psychedelics, being out in nature is definitely a notable one where people might like to take a hike or be out at the beach like you are today. And
It's a fake beach, but yes.
um, so there was a little bit of discussion in the chat, what do we know about, has anybody done any controlled trials in natural settings? And second part to this, are there any known risk or what you might think of as risk for taking a trip in nature?
As far as I know, there haven't been any controlled trials. I think there have been studies where people have assessed, people have gone to a retreat and looked at outcomes, but there hasn't been a systematic comparison of going out in nature versus not going out in nature. I think risks could relate to, in a sense, the natural setting. Um, for a beach, for instance, you have a chance to protect yourself from heat or light. Are you going to be properly hydrated in a hike setting, especially with any compound? And I think even MDMA would be included here. Anything that alters your visual perception might make a hike more challenging. So if something bad does happen, can you quickly get back to help or not? Um, so just sort of the general risks of just like if you taken a hike and brought some booze in some respect and a few different ones as well. I think that would be a really interesting type of study, and you could definitely do it if you had a natural space nearby. It's definitely not an impossible thing to do.
Yeah, so there is a new initiative at UCLA that's looking at psychedelic research in nature. I'm going to find the link. It's called Ecological Medicine and Psychedelic Studies Initiative. And I
Hmm.
believe what they're doing is creating an outdoor area on top of a building that would be like a
Okay.
natural garden
That's
where
pretty fun.
have experiences and see how being in nature impacted the psychedelic experiences. I'm sure there'll be other questions asked around this topic. And as far as I know, they haven't started any studies yet, but they have started doing some talks around this topic and providing resources and information
That's
about it.
pretty inspiring.
Yeah, yeah. And I know for if people go down to say Peru and take part in a retreat there, often the Moluccas or the areas, the space where they might hold the ceremonies are open. There's a cover on the top, maybe screen around to keep out bugs. But in that sense too, you're hearing the nature sounds, the birds, the animals, feeling the nature elements around you and being able to see them with still being in this protected container. So that's another idea around how the natural setting can take part in without being fully exposed to being in a forest. So, yeah, some people are saying that they actually guide in the forest, and I'm trying to see here. Dara, if you want to share your comment, you have to toggle to everyone. I am seeing some comments here that are just going to the host and panelists. Um, okay, so
I'm sorry, I'm not seeing any of them at the moment, so I'll
that's
take
okay.
care of
I'm going
that.
to find the questions here that are most pertinent to our topic here. Um, so we have a comment question here from Lincoln about the importance of education. And this is more important for participants, but practitioners too, since those who offer psychedelic assisted therapy but have shallow experience cannot provide much education. What do others feel about this? So education around setting, and experience. Um, how can I mean that's what we're doing right now, providing education through this free webinar
I
series.
hope.
Yeah, but are there other tips or things you think about for people to find good education or to reduce their risk around taking psychedelics and thinking about the setting in particular?
So I know that there used to be and maybe still are places like Dance Safe or local groups that talk about risks, usually more focusing on, say, a festival setting. Um, in respect to the sort of research that I covered, as you can tell, we're still in the infancy of really studying things. You can look at what people have done in the past, and all the way back to Stan Grof or the metaverse with MDMA, and consider those as I guess standards, but that doesn't, at least for me, that's not satisfying in the sense that you're looking at a convention or a tradition and not poking around and being an evil mad scientist and really looking at what things are useful. So I think we have to acknowledge when we're educating ourselves, as it were, that we really are at the start of what we're learning. You can look at traditions and at least assume that things are not going monstrously long, but don't trust something just because it's been a convention either. I guess I would keep one ear on communities that are currently structuring psychedelic assisted experiences, but also just be annoying. Look at what is being published in the literature for people who are trying to examine setting a little more, focusing on a trial and taking apart different elements.
Yeah, so this actually reminds me of a topic when we were both working on the MAPS clinical trials. The Midhoffers had conducted MDMA studies in Charleston, South Carolina, and they had a specific way which they had the room arranged with a futon and a chair on either side where the two therapists sat. Um, this way, they were able to, give focus to the participant. But once new practitioners came on and new study sites were being developed, people came up with other room arrangements. So one example was having the couch against the wall and then the two chairs in front of the couch. So there was a lot of discussion around, does this setup matter? I think the original one with the two people on either side is drawn from holotropic breath work
Hmm.
and the ability to sort of support from either side. So that was like an interesting topic of how much does the room furniture make a difference in a controlled clinical trial? And I think in the end, it was just kind of decided because the spaces were small often and had less availability of space to rearrange furniture in different ways that uh, any setup of the room would be appropriate as long as people were comfortable. And that's something that we can't underscore enough is the comfort of the therapist and the participants because it's long sessions, 8 hours long.
Absolutely, yeah.
Yeah, so having the ability to sit on the floor on some cushions, blankets, some bringing hot water bottles
Uh-huh.
can be that was an element that was introduced, I think, in the Boulder site where it was quite cold there in Boulder and body
Bring
temperature
your own
up
heating.
and down. Yeah, so having these bottles that could be filled up and heated in a microwave and then given to the participant to hold or put on their feet for warmth. So a lot of variability there, or as far as the way the room's set up and different ways of keeping body temperature at a um, comfortable place. Weighted blankets is another one.
Uh-huh.
And
I understand they're popular.
yeah, they're
Yeah.
popular to in and out of psychedelic therapy settings, but the idea is that the blanket itself has some weight to it. And so if someone's maybe feeling anxiety or needing more grounding, that a weighted blanket can make them feel secure. And so that's another element of setting. And as far as I know, in the MDMA trials, there weren't a lot of visual elements provided.
I think it did vary, but I remember that several people, both at the Boulder site and the Meadowverse, did have artwork for their space. I don't know what else they did, and it wasn't specified in the manual. It
Yeah,
was just something they did.
and fresh flowers.
Yep.
But nothing like what we might think of if you're at a festival with like visual graphics and visual art that's moving quite a bit. People can find themselves entranced by that type of
Mm-hmm.
art, which may or may not be conducive for therapy. I think we don't know.
Well, I mean, one of my own sort of journeys with music is realizing that you're not trying to be a DJ with the music, in a sense that, and this is true, I guess, of the artwork and imagery too. It's there to support what you are trying to do, so it shouldn't be too attention grabbing.
Right. So let's talk about the music. How are the playlists generally structured?
The ones that I'm familiar with, they tend to be about 5 to 7 hours long. They vary a lot in their content. I've seen some that do focus a lot on classical music. I've seen others that pull more from ambient music and world music. Some people have structured a bunch of different interlocking playlists, each for a part of the session from ascent, or when you start to experience the drug effects, to what's going to be the peak, to when people are coming down from those effects, whereas other people tried to make it a whole a whole playlist that could just go for the entirety of the experience. I think I'm assuming from looking at and the of the playlist that people are working from their own experience with the music, and perhaps are taking suggestions from other therapists. Um, but I would say that is the general structure. I guess there are two sort of options. One is the idea of trying to create different types of sub playlists that you can pull up and then change out if that momentum is no longer appropriate, and other people who just want to have the entire playlist there, and probably they can stop a song or skip to the next piece rather than pulling out a whole other playlist. And this is what I've seen on Spotify. Clearly, you can also work off your own music or other streaming platforms.
Great. Yeah, so I did share in the chat some of the playlists that Dr. Jerome put together for us, as well as an article that she wrote for our site about
Did, yeah.
incorporating music into the psychotherapeutic sessions. Um, and yeah, I'm saying a comment, you don't need music when you guide in nature. It's also a good point that music isn't always playing during sessions. The
Right.
silence or turning down the music and allowing a person to talk more without having
And
the,
having the control, like they can stop it.
yes. So they always have the option, I think, to have headphones on to go within, or if they want to take the headphones off and be in the room, that there are speakers also playing the music. So that can be a way to have the option to vary how the music is being heard or not. We
Yep.
also have some comments here about dogs, which also
Okay.
I love.
Dogs are part of setting, sure.
And there were quite a few therapists I know in the clinical trials with MDMA who had dogs present. And sometimes even the participant would be allowed to bring their dog to the session. So, in looking and reviewing some of the videos, you do see that the animals play a role. So, that is another element of that might bring comfort to somebody to have a dog to pet or just their presence nearby. And I have heard a lot of the therapists comment about like it seems like the animal just knows when the person could use some more support, and they might jump up on their lap or on the side of the bed to just be there by them if they're going through a rough time. Also, keep in mind, not every dog would be appropriate for this.
Oh, I was just thinking sort of if you have a dog and the therapist has a dog, you might want to see how they mix or just choose one.
Yeah, so yeah, of course there's allergies to worry about if you have a space. So making sure if you do want to bring in canine companions that they are welcome.
Like
Uh,
everything else, check first.
yeah, yeah, and some of you know that I've been really on this passionate about this topic of equine therapy. We actually wrote a course about incorporating horses into preparation and integration as a way of using their unique gifts of this being a large animal that has a lot of presence for individuals to incorporate them as part of a practice.
That's really interesting.
Yeah. So I'll drop the link if anybody's interested in this.
Definitely do. Yeah.
Um, so I'm going to look at some of the questions here. So we had a lot of comments and questions today that aren't really related to the topic. I do see maybe we should do another webinar on microdosing. Um, but let's get to this one from Diana. Is there currently a handout, pamphlet, or book that has suggestions for setting in a clinic for the patients? My experience is that the clinics are white walls and a reclining chair. I would think it would be common sense that plants, pleasant artwork, etc., would be a better experience.
Well, it's both sort of a statement and question. I mean,
Yeah. So have
the thing
you
is,
seen any handout that sort of describes how to make a nice setting?
I'm sure they exist. The only ones I know are like the manuals that I help working on, and that's not really a pamphlet. So, not being part of the therapist community, I'm not sure where those are, but I hope those exist.
Hey, maybe this would make a good article. Maybe we'll get this written at Psychedelic Supports to think about different ways of creating a comfortable setting. And, I know from my work on trials too, the other important piece is to have a bathroom that's nearby. And if you share an office with other therapists who maybe aren't doing psychedelic therapy sessions, you'd really want to have a bathroom that's connected to the treatment room. Otherwise, it could be a little discombobulating to take somebody, say, through a waiting room or like through various halls to find a bathroom. And then I know this is kind of not being included so much anymore to have overnight stays after the psychedelic experience. I mean, people are doing all kinds of things out there, but I think it's a great idea myself to have that extra time to integrate and process and settle in after the experience. But in that sense, too, the idea that the room could also be used as a place for sleeping and having a bathroom with a shower and
Well, then
all.
you'll definitely want a bathroom, yes.
Yeah. Yeah. And then food. We didn't talk about that. Do you want to comment a little bit about
Well, I
food
guess
during?
the one thing I mean, food does come up when people are describing in the manuals, and I think there are issues both concerning what substance you're using, some things you might need to restrict if you're using something that restricts MAOs. Also, some things like MDMA can alter how hungry you are, but you still may want to have food available, both, just as a nicety and as something to experience, but also because even though you don't feel hungry, you might still need something to eat. Um, so obviously finding out what someone wants to eat and as much as possible catering to that, but also being aware of any potential interactions between the substance or compound you're using in the therapy and the food you're offering. I know recently, I believe there was a study that in healthy volunteers that found that there wasn't much of an effect in terms of bad things between people who fasted and did not fast before MDMA, but that I believe the peak amount of MDMA in blood was slowed by eating something.
Mm-hmm. Yeah, I mean that's another element, right, of the actual more of this. We think mindset is the other element, but it's more the physiologic set. So of course, what you eat before can make a big difference, I'd say, on how you're feeling. Maybe you don't
Mhm.
eat a pizza before taking mushrooms. It might cause further digestive issues.
There is that. Yep.
So there's that, but then I think with the point with the MDMA study was to actually see if the metabolism of the drug has
Yeah.
changed.
Yep.
Yeah. So this is an interest, it's kind of a comment, but maybe you have something else to say about this. How might you standardize the interaction of set and setting and experiment? If you have the same setting, like music and colors can have different effects to different people depending on their preferences.
Right. And that's something that I started thinking about, that setting does kind of come back to influence set. And so if you're studying it, you want to measure both the actual variation and how people respond to it. In terms of like a real life, what are you going to do? I think it would be useful to have people experience or see the setting beforehand and let them comment. Say, no, that light, I don't like it, or yeah, that's great, I want that. and have some ability to change parts of the setting that you can change if people do express preferences.
Yeah, so this gets into a conversation we've had before about, if you were going to put together a playlist for a particular client, would you want to get some information about this client's preferences and,
You would, yeah.
how you might be able to fine tune, curate the experience for an individual based on, say, information they gave you about their likes and dislikes in regards to music?
That's probably a good idea. I definitely, from my own experience, I was actually at the Psychedelic Science Conference in 2023, and I was in a workshop of addressing music and therapists, and there is an exercise where we were all supposed to respond to music that the presenters played. And I noticed consistently that music that other people reported as calm or serene, I found it scary or melancholy or anxiety provoking. So there can be variation. And this is, if it happened once, I wouldn't think anything of it, but it seemed to consistently happen with the music that was being selected. On the other hand, I'd readily admit that some of the things that I might pick as calming, other people would think was a little loud and feedbacky.
Yeah, of course, everybody's got differences, right?
Yep.
Okay, well, let's see, we'll do this last question. Is there a study or case study on participants who did have vision impairment
Not
having
that I
outcomes that
know.
were unexpected?
If you know, please let me know.
Yeah.
There's been studies of, I believe there was at least one case study looking at how someone who is blind experienced a classic psychedelic, but that was where the visual impairment itself was the variable and
Yeah.
not looking at elements of setting.
And how about out of psychedelics?
Uh,
If you,
this was a study with LSD that I know of, or a
okay.
case
Yeah.
study.
But do you know of any research that's looked at people with visual impairments and found
Alas, no.
yeah. Well, I mean, I appreciate you bringing this to the table because when people have different clients with different needs, it was be really great to find out what their preferences are and if they're having an experience that is different, perhaps the dose could be adjusted or, maybe we find out that certain substances are more well tolerated for different populations. And,
Absolutely.
there is one example with the autistic trial with MDMA, that they incorporated things like fidget spinners and other tactile objects that would be soothing to that population in particular.
And if I remember correctly, that Alicia Danforth, who did the study, really what's the word, really communicated and collaborated with people within the autism community to set up the space before starting the trial. So that's a case where there was really attention to what did people prefer or find helpful.
Yeah, yeah, absolutely. Okay, well, I'm going to wrap it up. I'm going to drop all the links again here in the chat. So if you want to connect with Lisa, you can. You can listen to some playlists as well as check out some of the other offerings. And in the follow-up email, we'll send the talk, the slides, and the references, which are in this Adobe document in the
Thanks so
playlist.
much. Thanks for letting me talk.
Yeah, thanks so much. It was a joy to have you, and I miss our days of doing journal club together. So this was a
Yeah.
fun experience, and I appreciate everybody that showed up here. And next month we have a really interesting talk coming up. It's going to be about tarot cards and how to incorporate these with integration. So it'll be a really different kind of speaker, but I
Oh,
look forward to announcing this soon. We'll get you the date and all that through our newsletter and social. So. Thanks, everybody.
thanks. Bye.